The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
A baby is born with a need to be loved, and it never outgrows it. Good evening, one and all. I am Marina Francis. Welcome to BMC Global Live Al Hilal Health World. Nothing but lifestyle. We know that the care given to a newborn in the first few phases is very important. It is a phase where the parents feel quite concerned. So for all the new parents or expecting parents out there, in today's episode, we are going to discuss about the common neonatal and infantile concerns in pediatrics. And to throw light on today's topic, we have with us Dr. Gautam A. Shivananda. He is a specialist pediatrician with over an experience of 6 years. He has gained extensive training in neonatology and pediatric critical care by working in some of the best neonatal and pediatric care hospitals in India like Rainbow Children's Hospital and Motherhood Hospital, Bangalore. He is currently working at Al Hilal Hospital, Moharak branch. A very apt person to give us insight on today's topic. So let us begin with the discussion. Very good evening, doctor. Thank you for joining with us today.
Thanks for the call.
Yes, doctor. So to begin with the discussion, what are the different neonatal and infantile phases and why is it very important?
A newborn infant is unique in its physiology, and the healthcare problems that they go through thereafter are very different from the adults. Neonatal period is the most critical phase of life, because this has the greatest risk of mortality. What we call neonatal period is the first 28 days of life, and what we call infancy starts from 28 days of life and continues till 1 year. And neonate period we can subcategorize into during the birth, newborn period, just after the birth, and first 7 days of life is called early neonatal period, and last 3 weeks of it's called the late neonatal period. So like this we can come across different problems faced in different phases of these pictures, and we can highlight them so that we can educate the parents through the discussions what we are going through.
So then, doctor, can you highlight what are some of the problems in this neonatal period?
Yeah, normally at birth, what we encounter are there are certain common things like could be birth defect, where there is an anatomical defect in the body. For example, cleft lip, cleft palate, polydactyly, syndactyly, kidney swellings, neuroectodermal defects like anencephaly. There are many things, amniotic bands, which can cause anxiety in the parents as well as the treating team. Though we have sophisticated scans, anomaly scans, which are available during the pregnancy, but certain things are often missed out. So that causes a moment of stress and an outbreak in the team as well as the parents. So what are the causative factors for such in certain situations like this? If we come across, the course of the pregnancy is important, as we all know. The insults which the mother go through during these periods in terms of health issues, infections, chronic ailments or predisposing ailments, as well as certain medications and dietary intake factors. The medications which we use for hypertension, convulsions, and certain medications for treating infections like torch infections, Zika viral infections also we are aware recently we came across, which causes the anencephaly in the baby, and chronic ailments like diabetes, hypertension, hypothyroidism or hyperthyroidism. These are the predisposing factors which contributes the picture, and at that point of time these certain defects are surgically correctable. No need to worry about the issues, and certain defects, yeah, we can do as much as possible but remain throughout the life. This is about the birth defects. If you come across other problems, normally we see there are premature deliveries which requiring the admissions in neonatal intensive care unit. So because of the advancement of the science, we are able to salvage the babies as low as 400 grams. That's the standard we are living in. So and most of the parents go for the IVF, in vitro fertilization, because of the fertility issues. So those parents normally they come as outcome with premature delivery. Preterm we can call birth before 37 weeks. In that we can subcategorize into early preterm and late preterm. So in the early preterm or extreme preterm it was below 30 weeks, and late preterm is 34 and above, whereas preterm we call as 30 weeks to 34 weeks, because we can categorize different diseases in this. So normally they are more vulnerable because they are supposed to stay in the womb for the corrected gestation of 37 weeks, but they came out. So they compromised in all systems. Lungs are compromised, your excretory system, gut system, everything is compromised. So they need special care, and that takes a lot of time also, because the maturity takes 3 to 4 weeks to attain. So that causes financial as well as emotional drain in the parents. And thirdly, trauma. If the baby is too small or if the baby is too big, during the delivery any difficulties can lead to injuries. The common injuries what we come across are brachial plexus injuries, that's a kind of nerve injury, and facial nerve palsy, fractures, and the assisted deliveries where we use the vacuum and forceps that can cause physical injuries to the body. So we have to take help of assisted deliveries if the situation is demanding. It is not a choice, it's a necessary thing which we have to do it at that point of time. So these are the hindrances we face during the birth. When we come to the early neonatal period, that is the first 7 days of life, here we have two new people. One is mother, she's just got the delivery, her life is changed because she has entered into a different phase of life, and a baby who don't know anything. So we have to educate two people here. So we expect common errors and common doubts from the mothers. This causes special concerns. So as a team we have As a obstetrician, the doctor will educate the mother. As a pediatrician, I will educate the parents about the babies, what they go through at that point of time as well as ahead of that. So the concerns what we see here, breastfeeding concerns. Some of the mothers might not be having a proper nipple, like flat nipple or inverted nipple. So they may have difficulties in feeding, which will lead to underfeeding, which will lead to dehydration, which may lead to the complications of it, like low sugars in the baby, low calcium or decreased activity, which will end up in admission to critical cares. So at that point of time, I would suggest any small doubt is a big doubt. The mother has to highlight it. She has to get rid of the thing, because it can stop the momentum of error. That's one thing. Second, we may notice, you may be aware that there is a cold chain in vaccines, because vaccines should be preserved in the cold temperatures. That's a regulated cold. Like production site, they are produced in the cold temperature, packed in the cold temperature, transported in the cold, as well as delivered to the baby out of the fridge. Similarly, we have warm chain in the babies. Warm chain is something like the womb is warm, the baby's temperature is maintained inside the womb, and when the baby comes out, we have to maintain that warm chain. How we can do? By having a warm area with the warm linen cloths to resuscitate the baby soon after the birth, as well as putting the baby in the warmer. Once mother is ready, we can keep it on the chest, keep the baby on the chest, like a kangaroo mother care. You might have heard about that. So that helps in regulating the body temperature. As they are very vulnerable, the babies are small in size, they can easily lose the temperature. That can disturb the metabolic pathway and difficult transition. So this is the thing, and like this, these are the concerns we can expect in the early neonatal period. In the late neonatal period, most of the concerns they carry forward. The feeding issues, the social stigmata. Some of the mothers, educated mothers especially, they are concerned if they breastfeed the baby, it will disturb their physique. It's a natural stigma which they are carrying. I would suggest everyone has to breastfeed, because there are too many advantages. One, it helps you in the reduction of the weight loss. Second, it helps in the maintenance of contraception for the 6 to 8 months. As long as you breastfeed, there is a natural contraception. Third, it protects the baby against the infections. And fourth, it is the best food, as we know. So no need to carry the stigma. Please give as much as feeding as possible. Second issues, we notice there can be a weight loss. Normally in babies, what we see, there is too much water, because baby was inside the system, so it was floating in the system. So we as an adults, we carry 60% of our body weight as water, whereas babies can carry up to 70 to 75% body weight as water. So once they get transitioned into the extrauterine life, from the intrauterine life to extrauterine life, they don't need that extra water. It loads the system with extra load, so they have to shed it off. It is natural to lose 10% of the body weight once the baby is born. So beyond 10% of the weight loss, then we term it as a significant weight loss. So what are the causes of significant weight loss? Underfeeding, most of the commonly underfeeding. So how to address feeding? The mother cannot recognize whether she is adequately feeding or not, because there are no reliable indicators. Because there is a natural weight loss. Mother thinks even if I feed, I don't feed, there is going to be a weight loss. And you cannot assess the quality of sucking. Baby may be latching just for a pacifier action. And third thing, the duration of the breastfeed doesn't correlate to the volume we have given to the baby, because initial days there is a less lactation. The breast milk will not be adequate, because it gradually scales up to the full optimum level by 10 days of life. And there are certain factors which are inhibiting the lactation, like maternal stress. She is in a different place, she has just undergone delivery, and the baby has just come out, it is change of life. And the second thing, there is a pain. Pain also is a natural inhibitor of lactation. There may be cesarean section, there may be assisted deliveries which are still on, the pain is there. So these two factors in rest. That time, as a social support, we can involve nursing staff, midwives to counsel the mother as well as obstetrician, and ensure that the breastfeeding is taken care. She may be not be aware of the breastfeeding techniques also, which also can be help from the team to help. So that can reduce the weight loss situation. So 10% we can keep it as a room, not beyond 10%. And neonatal jaundice, I'm sure you are aware of it. There is a yellowish discoloration of the body. Naturally, what parents think, we were not informed about that when we were young or at that time, but now the information is everywhere. Everyone is aware there is a jaundice. We expect jaundice when we come. No need to compare it to the adult jaundice, because the causative factor itself is totally different. Adult jaundice arises because of the liver problems and infections, liver infections and certain blood disorders. Whereas in newborn, the jaundice is essential jaundice. It's a nature's law. It helps the baby for transition of intrauterine to extrauterine life. There is a different hemoglobin in the intrauterine life. There is a different hemoglobin in the extrauterine life. So the old hemoglobin has to be taken out. New hemoglobin has to be produced. So adult hemoglobin has to be produced. During this process of metabolism of the old hemoglobin, that is fetal hemoglobin, the byproduct is jaundice. So it depends on the baby's capacity to metabolize it quickly or metabolize it slowly. So certain babies, they are very active metabolically, they produce too quick. Certain babies, they take time. So naturally we keep from 0 to 21 days of duration for the jaundice to show up and disappear. So if the numbers are below the cutoff range, then we have to help the baby. Naturally, the common help what we do is phototherapy. In that we use ultraviolet rays. That helps the jaundice molecule, bilirubin molecule, to get into polarized and easily excretable product, because our excretory system is water. Bilirubin molecule is not water soluble. We have to make it water soluble. Liver is doing the job, but liver is tired because of the too much levels. So we can help it in that way. Usually we give phototherapy for 24 to 48 hours. Then the problem solves. So that's how. And the third thing, inborn error of metabolism is one which is commonly missed everywhere. Our body is a chemical factory. We have too many metabolic pathways going in us. There can be error in any metabolic pathway. So we don't know whether the baby has error or not. Normally in developed countries like Europe, America, Canada and Australia, government is offering to conduct an inborn error metabolism test at free of cost. Whereas in developing countries and underdeveloped countries, the burden goes on parents. So this is a screening test called Guthrie test. We call it as a newborn screening test to check the inborn error of metabolism. They conduct certain common metabolic errors which are seen in day-to-day life or which are frequently seen. So in that there are panels for the 6 test, 21 test and 108 test. If there is a family history of metabolic error, it's best the parents can get the test done. If there is no family history of metabolic error, at least the basic test they can get it done, because that will ensure baby is good, because once the feeding is started to the baby, the metabolism is on. Once the metabolism is on, the disease starts showing up. So if we get to know at the earlier period, we can prevent it, or we can make the damage to the minimum. So these are the things we see commonly in the newborn period, and I hope this information is good.
Yes, definitely, doctor. So you have already elaborated on the concerns and problems that you commonly see. So is there any warning signs that the parents should go for immediate help?
Yeah, I would highlight both the sides, the warning signs as well as normal signs which look scary. There are things which look scary but need not to be scared. There are things which looks normal, but you have to be proactive. What are the normal things I will tell first? See, the baby may spit out some milk. The baby is learning to feed, the baby is learning to digest, the baby is learning to pass the stools. So we have to give room for the learning, the time for learning. We think as an adult even one vomiting is abnormal, whereas in baby it's okay if there are small spit outs. If the spit outs are too much in volume and they are projectile and the baby is not gaining weight, then it's an alarming sign. And there can be some rashes on the system, the skin, because the skin has come in contact with the world first time. The skin has to learn its memory. They don't know what is allergen, the skin doesn't know what is allergen, what is normal thing. So whatever it comes in contact, there is some reaction from the skin. So on those areas we may see certain acne type of lesions exposed, like pimples. It is called erythema toxicum. This is a natural phenomena. No need to treat, no need to put any medications. Only thing you have to take care is utmost hygiene, because these are the breach areas. They can set any dust or anything to go in and cause infection. So only the hygiene is more than enough. And third thing, excessive cry. We see excessive cry and mother thinks it's abnormal. Excessive sleepiness. In the excessive cry, I would highlight any parents to ask one question for themselves. Is the cry consolable or not consolable? Maybe it disturbs in the midnight, the baby cries in the midnight, they get, my baby is not okay. So if there is a consolable cry, try holding the baby and try to console the baby. If the baby settles down, that's natural. Some babies take time, but it's natural. If there is an inconsolable cry, then the parent has to be worried. Like it could be colicky pain, the gaseous issues in the abdomen, or it could be ear pain, or it could be some pain in the body, maybe tight clothing, maybe uncomfortable clothing, maybe too much of temperature. That are the things which parents has to be, they can address at home. If they don't understand, they can definitely come and consult us. And if we come to the abnormal signs now, as I mentioned earlier, the weight loss more than 10% is a significant weight loss. So it's a question of quality care, whether we are giving it or not. So that time they have to consult the pediatrician. Second, decreased activity, decreased sucking efforts. The energy of the baby has gone down. So that's not something normal. And the change of color, naturally the baby will be pink or the color. It can turn blue or it can turn pale. The change of color has to be a concern. Third, the urine output. If the baby has not passed urine at least once in 6 hours, that's a sign of dehydration or that's a sign of underfeeding. So that also has to be taken care. And any fever in the baby, as in adults, when we get fever, we take paracetamol and we wait for the time. If it worsens, then we go to the doctor, then we take further treatment. But that should not be attitude in the baby care. Less than 6 months, fever is an emergency. It has to be addressed immediately, because the size of the baby is very small. Any infection can spread in the system within minutes. They can land up with shock, they can land up with complications. So it has to be addressed immediately. Never ever don't give the paracetamol to the baby and wait for a day or two. That's a very gross error from the parent side. And yeah, these are the most common warning signs here.
What could be some of the problems or concerns faced during infancy period? Can you categorize them also?
Infancy period is the most joyful period for any parent, because by the time baby becomes infant, it learns something. The baby smiles at mother, at father, it starts making sounds, and it's a playful time. And it becomes more playful as the baby grows on. So by the time mother has also learned something about the baby, she understands the nature, what is the normal pattern the baby is going through. So the momentum is set, care is good, because mother is trained and baby is also trained. Where the things can go wrong, most of the times the nursing issues are not the problem in infancy. In infancy we come across the other kind of issues, because the baby starts moving everywhere, naturally they're explorative, they're curious about things, so they want to touch everything. So we can categorize the problems in such a way, like a nutritional problem, growth problems, developmental problems, infectious problems, and skin issues, accidents and poisonings. These are the categories we can commonly see the problems, and where parents are not aware of many things, how to act, how to recognize the problem, and how to solve it. So these are so we can highlight one by one. Like when we talk about nutrition is nothing but nourishment. It starts from the day one, from the baby is born. It starts with the breastfeeding and goes along till 6 months, and at 6 months we start the complementary feeds, and it goes out further. So breastfeeding is a perfect feed for the baby. So certain mothers think the production of the milk is not sufficient, or if they give the feeding, they may have certain physiological disturbances within them to perform at their career and all. That stigma has to be completely taken out. WHO clearly mentions, and every literature is there, it protects mother as well as the baby. And when we talk about the complementary feeds, complementary feed is not a substitute for breastfeed. Both has to be continued. So mother will continue the breastfeeding as well as we start the feeds. Most common problems what we see during the complementary feeding, parents think whatever we cook at home can be given to baby. But babies are totally different in terms of their nutritional demands compared to adults. As an adult, we take food to keep our body weight same as well as to meet our energy demands for the day-to-day activities. Babies or infants, the body weight is increasing very rapidly. It's an exponential growth of weight, what we see in the infancy, and their energy demands are too high because from the non-physical activity from the newborn time, they are changing to the physical activity. They're trying to move, they're involving with all the energy spendings. So the food has to be optimized for that needs. Here, how we can optimize? If you come to nutrients, there are 7 components, like you may be aware already, some of them: carbohydrates, fats, proteins, and vitamins, minerals or trace elements, fiber and water. These are subcategorized into macronutrients and micronutrients. Macronutrients are nothing but building block of the body, to build the body. That is carbohydrates, proteins and fats as well as water. Micronutrients, these are called primary nutrients or building blocks of the body. First one what we address, and this second one, micronutrients, are protective principles of the body. They don't need in too much quantities, they need only tiny quantities. That's why we call it as micronutrients. So here we see vitamins and trace elements. Vitamins and trace elements, they are protective principles because they help in metabolism. They don't need too much, but they are important at certain stages of metabolism to accelerate it, to control it, to regulate it, to catalyze it, the metabolism. So these help in building the immunity, these help in regulation of the life within us. So, and regarding the fiber, fiber per se is not a nutrient, but it is an essential component in the nutrition because it helps in holding the moisture throughout the gut. The stools will be soft, it makes the stools easily excretable. It is also a nutrient for the symbiotic organisms which are within our systems. There are symbiotic organisms within our systems. These are the helpful bacteria which metabolize the undigested food substances and avoid providing the harmful gases, and it also helps in killing the unwanted microbes like other infectious agents, and they also synthesize certain vitamins which are essential to our system. They are protective also. They help in improving our digestion as well as they help in building our gut immunity. So this fiber acts as a nutrient for the symbiotic organisms which are there. So either way, everything is a key, everything is very vital. So how we can arrange these things and take into our systems? So there is a concept called as balanced diet. Balanced diet involves energy as well as food principles. Energy tells the balanced diet subcategory is balanced energy. How we can derive our energies? When we eat naturally, we don't know how much fat is in it, how much carbohydrates in it. We are not aware. Generally, we are not aware. Let's be truthful. So it tells 55 to 60% of the energy has to come from carbohydrates. 20 to 25% has to come from the fat, and 10 to 15% has to come from the protein. Then the energy demands are properly channeled. So there is no disease. If you take care of the channel properly, there is no ailments. And about the principles, if we talk, normally it categorizes into 5 principles, like 5 fingers. whatever we eat daily should consider these 5 principles as a content in our food. One is vegetables and fruits, second cereal, puzzles and millets, third milk and milk products, fourth meat, fish and egg, fifth is fats and oils. In our 24-hour diet chart, this has to be there. These all 5 principles has to be there. So that is how the healthy diet. So when we talk about the diet, there are 3 critical phases of life where the diet is needed at optimum. These phases includes first phase at 6 months, when we are transitioning from breastfeed to the complementary feed and the baby is growing, because these periods demand extra nutrition. These periods demands more energy to go for the next stages of life. So this is at 6 months. And second, when the child starts too much physical activity, that is around 1 to 2 years. That time also the optimum nutrition has to be met. And third is during the puberty, because the height shoots up, the hormonal changes starts and they enter to the different stage of life, adolescent stage of life. So that is 10 to 12 years in females and 15 to 18 years in males. So this phase, if the energies are not taken care, the nutrition is not taken care, that will grossly impact the long-term neurological as well as physiological impact on the system. The chronic health ailments which we encounter at 30 years, 35 years, the root cause can be here. We don't think back. We don't blame or we don't address it. We are not aware basically, because what happened at 5 years we don't remember at 20 years. So that is the thing, and we don't take it as a correction and we don't fix it in our children. So this part of the phases has to be taken care. So how to introduce the complementary feeding? Children at 6 months, infants, they don't have teeth. Teething is just started, so they don't chew the food. And there are certain cardinal signs, cardinal components, how we can introduce the feeds. One is what food to give, just we discussed. Second, how to give, the consistency. Third, the frequency. Fourth, the hygiene. And how we feed, the atmosphere of how we feed. When we talk about the consistency, it is better to give them as a puree. No need of chewing, and you can make it a puree. And this puree should not be of plain rice, plain roti, plain vegetables. What we can do, we can involve all the 5 principles, boil them in a pressure cooker, overboil them, to make it very soft, and we can blend it into a puree and give it to the child. How much we can feed? Naturally the quantity, the demand, see the stomach volume is, for example, is 150 ml. Let's keep an arbitrary value. Even if I give rice, they feel content. If I give chapati, they feel content. If I give water also, they feel content. Our goal is not to make the baby content. Our goal is to pump the nutrition and meet the nutritional demand. This is something called isodense formula. For example, 150 ml volume of rice has carbohydrates. It does not have fat, it does not have protein, it does not have trace elements and vitamins. So giving that will only meet the physiological needs of the baby, like content, but it will not meet the nutritional needs. So how we can increase the calories or the nutritional value? We can put 2 spoons of ghee, we can put some dry fruits powder, we can add some meat, egg, we can also add some fruits, we can also add some vegetables. So this overall we can keep the volume same, the feeding volume will be same, but the nutritional quality has improved. So like this you can improve the density of calories in it. Third thing, when we feed the baby, normally we think the how we eat food, the baby also will eat like that. It's a natural tendency, any parent. We want to go to office, we want to do certain work, so we finish our breakfast, lunch or dinner within 10 or 15 minutes. That is not the way it's going to work with the baby. Babies are different. They're just learning how to feed, and they want to take their own time in learning of it. So mother cannot expect a baby will finish the feeds in 15 minutes. And mother cannot give up if the baby has not taken feed in 15 minutes. Yeah. So persistence, discipline and dedication, they all come into factors. first 6 months of life, the milk was ready, baby was ready, it was easy job, it was a highway. Now the real job of parenting starts. Preparation of food and giving the food, each time it will take roughly 1.5 hours. 30 minutes to prepare the food and 40 to 60 minutes to give the food. And when we give the food to the baby, there should not be any distractions. It should be playful, it should be interactive, and it should be enjoyable for both the feeder as well as the baby. That requires an isolated room where there are zero distractions. Nobody can come and disturb, because any distraction, baby's focus goes away and they will not feed. Second thing, using the screens is not recommended. That's a shortcut, but that kills the explorative nature of the baby, because it's a quick entertainment which makes the baby, natural things will look least interestable. And before we feed the baby, it's better to keep the baby fasted for a period of 30 to 60 minutes. For example, if you get hungry, you come to our home for a lunch or example, I give you some chocolates, your appetite is gone. You don't feel like eating the full lunch. You will eat a half lunch. Same thing happens with the baby. When the baby gets up and the lunch time or breakfast time has come, better to keep the baby fasted for a certain period. We love kids, so we give certain biscuits, certain chocolates, or certain things out of love, but that compromises the food intake. Instead of taking the 150 ml, they will end up taking just 50 ml. They'll feel content very quickly. So you can always love the baby with the things after the food is given, not before the food is given. Then I want parents to stick to the schedule religiously. We can compromise our lunch timings, we can compromise our dinner timings. That is not the case with the children. We always want them to take food in that particular time, because if we miss the window, the time is gone, the appetite is gone, we will enter to the different times where the baby wants to play, baby wants to sleep. Yeah. So whatever the priority works we have in our lives, it has to be kept aside. Pay attention to the first priority is always the baby. As a pediatrician, I would strongly emphasize this, because we may go to functions, we may go to certain works, or we may come back late, which has missed the window of dinner. So religiously follow the timetable, don't compromise, and religiously follow the feeding volume. Stick to the time. It's a game of patience, dedication. Yeah. And hygiene, I know you are taking care of utmost hygiene, because both the parents are educated. Then about the handling of the utensils, I would suggest parents keep separate utensils for the baby, separate feeding bottles, separate feeding tray, separate feeding chair, everything, and sterilize them timely. Using the steam sterilizer is best. If not, a boiling water for a period of 30 to 40 minutes, dipping in them is best, because using the same utensils is not going to serve the purpose. The baby can easily get infected from the other source. Yeah. This is about the nutrition, and I would like to highlight a small story. When we were practicing in India, most of the parents are highly educated mother, educated father. They come around 2 years of age. They tell certain things what they want to address, and I check the weight. The baby weight is 8 kg. Normally the 2 years we expect a weight of at least 12 to 14 kilo. Then I cross question them, what was the weight at 6 months? They tell it was 7 kg. So entire 1.5 year it has gone with just 1 kilo. So when I ask what was wrong, they tell baby doesn't eat. That is the thing, that is a common thing what they tell. When I ask them to go through the charts and how you feed, how much time you take, how much quantity, what are the types of food you give, they commonly tell we give rice, we give idli, we give bread, whatever they cook at home they give. So that is the kind of damage a baby can have. A 7 kilo at 6 months and 8 kilo at 2 years, it's not a problem with the baby, it's a problem with nutritional education, awareness, and implementation and execution of the work. Yeah, it doesn't require too much of things, but yeah, it requires minimum parenting what we can best give to the baby during the transition period of 6 months and 1 to 2 years, where the nutritional demands are very high to augment the rapid growth. So I want all the parents to understand this gravity, because by the time you understand, it's already late. Low weight baby has their own complications. They will land up with malnutrition issues. Any baby which is having malnutrition can have low immunity, because after 2 years to 3 years they enter into the schools, they will get into the other children, they mingle, they get infections from them, and it is not easy to treat. The recovery is not is as fast we see in a well-nourished child compared to the malnourished child. Malnourished child always take more time to recover from all the illnesses.
Yes.
Yeah.
Very much true, doctor. Is there any diet plan or any guidance that you can give to the parents?
We discussed most of the diet plan just now. So sticking to the cardinal components of the diet, following the discipline, ensuring the dedication is being met. For example, if one of the parent is busy, let all the caregivers be aware of the facts, how the diet has to be given, how much to be given, and what time it has to be given, and timely checking of the weight for the monitoring of the growth, to ensure the baby is on the right track and the optimal road to health. There is a road to health in the graphical representation, where the weight is always in the 50th centile, near to the 50th centile. So that can be checked when you come across for vaccinations during the pediatric consultation. So we will ensure that the weight is going well, and you can also always openly discuss with the medical staff like pediatricians or nutritionists or a trained nurse to give you a diet chart which you can incorporate, customize as per your cultural needs, as per your natural resources what available at home. You can always improvise, you can always be a better diet giver for your baby. Don't set the limitations, there are no limitations. Yeah, and no need to compare with other children. My child is 10 kg, the other child is 9 kilo. It's not like that. Each child has its own potential, its own thriving capacity. We will give our best, whatever happens it will be best. Yeah.
Doctor, what are the common mistakes that you have encountered that parents do regarding the nutritional needs?
Nutritional needs, most of the times they are not aware of the fact. Though we are highly educated, this is a new task, and nobody has good info, or nobody trained us before we enter into the phase. That is where the key role of pediatrician comes, to educate the parents. So it's better always to take a diet chart from the known thing and implement it as a gold standard way. We need not to put our own inputs. Our own inputs will not come out of experience, will come out of intuitions. So we do mistakes, and by the time we correct, it's late. So pediatricians can help you with the diet charts, and following the schedule is another key important thing, and monitoring the growth is another important thing. I would suggest parents to monitor every month weight check after 6 months. That also gives them the confidence. As a reward, my child is growing. That keeps them motivated throughout the journey. And any point of time, if they come across the weight is not gaining up to the optimum levels, they can always question us, they can ask us suggestions, and they can always take the treatment from us. Yeah.
Doctor, one common doubt that mothers have is, till when should we continue the breastfeeding? What do you advise?
Yeah. There are confusions, I agree with you. Breastfeeding starts at birth and continues as long as the baby wants the feeding. There is no upper limitation. It's all like customized. So exclusive breastfeeding is the terminology we use for the counseling of mothers. What is exclusive breastfeeding? In the first 6 months of life, only breastfeed has to be given, not even water. So that is called exclusive breastfeeding. So when we transition from 6 months using the complementary feeds, mother can continue breastfeed up to 2 years of age along with the complementary feeds. If the mother is giving breastfeeding, the complementary feeding frequency we can keep it as 3 times a day, breakfast, lunch, dinner. By chance, if the mother doesn't want to give breastfeeding, or maybe because there are concerns, she has to go for work, she may not be available for the child. In that situation, we recommend at least 5 frequency feedings, like 5 time feedings in the baby. That augments the appropriate nutritional needs at that point of time. But whenever they are free, they can continue the breastfeeding till 2 years, at least till 2 years, because the brain growth, there are certain fatty acids required in the brain growth which come only from the source of breast milk, which are nowhere available in the nature except the breast milk. So these fatty acids cannot be synthesized in the laboratories and put it in the formula. So if you continue the breastfeeding, it helps them to become more intelligent. When you compare the child given breastfeed for a longer period of time at the point of 15 or 20 years, they are naturally more intelligent in terms of academics, in terms of thinking, in terms of social. They have the very high IQ. They have a margin over the other people who are, so that is how crucial it is breastfeeding is.
That was very insightful, Doctor. Thank you. Viewers, stay tuned. We will be back after a very short break.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
Welcome back. You're watching BMC Global Live Al Hilal Health World. Today's discussion is on the topic common neonatal and infantile concerns in pediatrics. With us is Dr. Gautam from Al Hilal Hospital, Muharrak. Doctor, moving on with further categories of different problems that you mentioned.
Yeah.
Infections was one of them. So
Correct.
what are the common infections seen in infants?
When we come to the infections, being in Bahrain, we see a lot of infections here because infections, they spike in seasons. For example, we see in summers gastroenteritis, in winters we see pneumonias. We have a peak of season changes here. We have extremes, we have difficult fast transitions. Suddenly the temperature will go up, suddenly the temperature drops. As an adult we are already acclimatized, but as a children they are not acclimatized yet. They face difficulties when there is a transition of seasons. So that is how the outbreaks starts and childs rush in. So every time we season change, our pediatric department is full. So this is the reason. And when we go for the categorization of infections, whenever there is infection, we commonly see fever. Fever is a natural sign of infection. So there are many contributing factors for infection: viral infection, bacterial infection, fungal infections. Being in a humid area, we see commonly fungal infections also here. And if we go further detail, we can systematically divide it. For example, in the CNS, central nervous system, we come across meningitis, encephalitis, and if we come to the head and neck region, we see sinusitis, acute laryngopharyngitis, tonsillitis, and common cold, flu. And when we come across respiratory down system, lower respiratory system, we see pneumonias, we see bronchiolitis. Bronchiolitis is something which I want to highlight here because it is rapid, it occurs very fast, and most of the parents, there is a very minimal signs except the fast breathing. The child will breathe quick, very hurried breathing the child will have, and that can not show up in the parents so quickly. So, and usually worsens it overnight. The child will be having mild symptoms in the morning, and the next day the child is bad. So, any parents who see the child is having a mild cough along with the hurried breathing, don't wait for the treatment. You have to consult the pediatrician and start appropriate treatment as early as possible, because the oxygen levels in the baby can drop quickly. That can lead to the further unwanted results. So, humidified oxygen is the very simple treatment in bronchiolitis, which helps the baby to come out of the problem very easily. So, but it has to be started in time so that we can prevent many of the unwanted things. Then when we go to the gastrointestinal systems, we see vomitings, we see gastritis, we see gas issues, abdominal distensions, and we also see diarrhea and dysenteries. Some of the agents in infantile period or neonatal period causing gastric disturbances most commonly are viral, rotaviral illnesses, which we already have access. But anytime the mutations can happen, still they can cause some altered viruses can contribute again for the same picture. We also see bacillary dysentery. Here, though the parents are giving best food, the sterile hygienic food, still the babies are prone, because at 6 months of age they start exploring. They put things in the mouth, the hand to mouth coordination starts, they reach out to objects, they go everywhere, they are more exposed than the earlier period. So, and they are exposed for first time. So, the body is still tender, the immunity is still in the beginning stage. So, they will face infections, and that can contribute for dysenteries. And when we come to the renal system, renal and excretory system, they may have pyelonephritis and urinary tract infections and cystitis. Here, the young females especially, they are much prone, because they have a shorter excretory urethra, they have a very small urethra, which can make the pathogens easily access into the urinary tract and start showing the manifestations. So, I would suggest parents not to keep the diaper for a very long period. Frequent changing of diapers is very good, like 4 hours once. And while cleaning the genital area, utmost attention has to be paid not to touch the urinary area, because the backflow of the water can easily give access to the infections, urinary tract. Then when we come to the skins, the skin infections also are very common, because they start exploring and the skin touches here and there. So, some bacteria can arise, and we see impetigo, bullous impetigo, and blisters. And when we come to fungal, there are candidal infections. In candidal infections, most commonly it affects the mouth, oral candidiasis, and sometimes it can affect the diaper area. We call candidal diaper rash. So, appropriate treatment and are available. No need to panic. No need to blame themselves, because this is the age they play, they explore the world. So, it is not a mistake of parents, and I want them to play more. But you can take care by giving them an infection-free zone, and you can by early recognition and helping them reaching out pediatrician early. Yeah.
Yes, doctor. As you said, it is the time for them to play and explore.
Yeah.
So,
Yeah.
But then, how do we prevent these infections?
Prevention of infection happens in multiple levels. But when we come to the understanding of infection, there are 3 factors playing. One is the host, that's the baby. Another is agent, that is the infective organisms. Third is environment, that they're in. For the host, what we can do, how we can help the baby to become more strong, giving good nutrition, giving them optimum weight. So, the capacity of the body, the immunity is at optimum level. Giving vaccinations. Bahrain is very good government protocols and policies for the vaccination schedules, and it is very strict, because the schools are also not permitting the child to get in without vaccinations. So, giving timely vaccines, and then giving nutrition. And this one for the agent, keeping the atmosphere very much tidy, taking care of the toys, especially the toys which go into the mouth, they get dusty and all. I would recommend parents daily wash the toys at the evenings. So, morning the child can collect the fresh toy for playing. is one of the easiest way and is best to prevent. And second thing, hourly hand washing. Let the child play, but make sure you wash the hands every hour or every half an hour once. Whenever you feel there is a certain thing on the hands or that, you wash it immediately. And I also suggest not to use the sanitizers. Sanitizers are chemicals. Again, it goes into the system when they put by mouth. So better to use plain water or a soap water. So these three factors we can, optimize of and may help the baby to thrive better without infections.
Doctor, another concern is the accidents or poisonings that happen during the infancy period.
Yeah.
How important it is to address such cases?
Children in infants, they are it's most common in that age group. The reason is, first of all, they want to go everywhere. They want to play. Second thing, they are curious about things. They want to know what it is, the things. And third thing, they don't know which is harmful and which is harmless. And most of the ingredients commonly we use, they are consumed, accidental consumption of the children. So like it can be pharmaceutical products like medications used by the other caregivers of the baby, which are used commonly for fever, infection, antibiotics, antihistamines, syrups, and it can be chemical products. Chemical products are like household shampoos and ink, batteries, and naphthalene balls which we use in our dressing cupboard, and paint items which would have kept somewhere. So these are the items. So this is about the accidental consumption of dangerous things. When we come for poisonings, how to recognize it? Once the poisoning has happened, how to recognize it early so that you can help the child. Any poisoning will show acute and rapid manifestation. A child was playing well, suddenly fallen sick. That's a warning sign. That time you need not to think about other diseases. First thing you have to think is there could be a possibility of poisoning, and you have to rush immediately to the hospital and give them a clue that it could be poisoning. And you may be seen that atmosphere where the child was playing, the environment where they were playing, there may be certain items, it may be broken, it may be spilled everywhere. So you can get a clue from that zones, and you can promptly tell which item was also possible consumption. So there are antidotes available, there are methods available to treat. We can do gastric lavage, we can help the baby. There are helplines available, helpline numbers 24/7. You can directly call if it is an unusual time or unusual place, you are far from hospital, you can directly access the helpline number. They will promptly guide you what to be done step by step. So you can treat wherever you are, you can start the treatment.
Similar to that, these accidents and injuries that happen during this period, how to actually face them?
Yeah, the most common accidents what we see are fall from the cot. Fall from the cot, or taking the heavy objects on themselves, and bruises, minor bruises, injuries, or the baby is lifted up holding the hand, which could cause the dislocation of the elbow joint, which is very common. We call it as a pulled elbow. So these are the injuries. They are very prone because you will be surrounded yourself with the work. The parents will be surrounded themselves with the work, and they may not pay attention for a minute. Maybe it's a very small fraction of time, but by the time the damage is already started. So how we can deal with it? One, we can keep the rails on the cot, or at least make the cot as low as possible, because when we are sleeping we may not be aware they will move and they may fall down. And you can also keep cushions just side by to the cot. That is about the height injuries. Second, regarding the heat injuries, you can set the temperature of your geyser. If the baby goes accidentally and keeps the tap on or touches the thing, the heat utensil or something, you can regulate the temperature so that it is not too warm. It may not. And electrical plugs can be fixed with a dummy plugs. Insulation plugs come, child safety plugs comes, that you can buy online, and you can fix it, so that because the plug lines are lower in our households, that is very easily accessible to the height of the child, so that they can take care. and we can use the products which are already automated for child safety. There are many products available with automated, and you can also use automatic locks. There are small cupboards which we keep the medications or any other chemicals that can be locked with the child lock. So child may not feel like taking it out, so that can prevent the situations. And I would suggest parents to actively involve and always have a kind of attention. At least one person has to pay some attention. If there are 3-4 people, one has to give and immediately interfere and make sure. And for the water bodies, you can put the rails around the water bodies so they will not. And you can also use the cameras, home cameras. So if the maid is taking care of the baby, you can monitor from the home and make sure things are addressed timely. Yeah.
Doctor, talking about the growth and development of the baby, are both growth and development same? How would you understand the growth and development?
Growth and development are commonly used as interchangeable terms in the normal day-to-day life, but they are the two facets of the same domain, but they are totally different. If we tell as growth is about quantity. It is about increase in the mass of the baby. It is about the strength. And if you come to the development is about quality. It is about attainment of higher functions and higher capabilities. So growth and development are two distinct entities, but they go hand in hand. When we talk about growth, the growth starts from the day one of conception. It is intrauterine. And normal weight of the baby, if you tell, it should be at least 2.5 to 3.5 kg when the baby is born. That is, we call it appropriate for gestational age. That means the growth of the baby is adequate in the intrauterine life. Here onwards, the nutrition starts, breastfeeding starts, complementary, and everything goes hand in hand. So here onwards, monitoring the growth plays a vital role. It is an assessment for a parent how they are giving the care for the baby. So when we tell how we can monitor, naturally the weight doubles at 4 to 6 months. For example, the baby is born 3 kilo, it will touch 6 kilo by 4 to 6 months, and the length doubles by 4 years. If the baby is born 50 centimeter in length, average baby length, it will become 100 centimeter by 4 years. These are very crude ways of assessing. Another ways, when we come for each vaccination visit, you can always ask the nurse to check the head circumference, length, weight, and ensure that it is growing as per the standards, as per the norms. So that, and also involve optimum nutritional, as we discussed before, including all the components and the key criteria. Make sure it is taken care, or you can always correct it later also if the growth is lagging. There are certain medical disorders also which disturb the growth, like hypothyroidism, the hypothyroidism and growth factors which are there in the body, and diseases. When the child gets back-to-back infection, that compromises the nutrition of the baby, so that can bring down the growth rate. Yeah.
So doctor, what could be the long-term implications of the growth not being right in the later
It's
life?
a very important question. There are certain diseases which are set during the starting period of life itself. Everybody was astonished when this statement was made in the international platform. There is something called as fetal origin of adult disease. So, supporting to this statement, the evidence was provided. What we see, chronic hypertension in the adulthood, or diabetes, thyroid issues, or any other metabolic disease or any other chronic diseases, the root cause comes from the fetal origin. For example, the diabetes, it's a disease having hormonal imbalances, especially insulin. So when that means the body demands insulin are not met properly. That means the body is not producing adequate insulin for the demands of the body. Why? Because which organ produces the insulin? Pancreas. Pancreas, the insulin is produced, and if the baby weight itself is small at birth, like say, the baby is small for gestational age, less than 2.5 kilo, less than 2 kilo, then the resources of production capacity of insulin are limited. It will not be as same as 3.5 kilo baby or a 3 kilo baby. For a weight of 3 kilo, that time it may be enough to supply the insulin, but when the body weight increases to 50 kilo, 60 kilo, 80, 100 kilo, there will be a threshold where the control is gone. The demands are not met adequately and the organ eventually fails. That causes the onset of diabetes. And this cardiovascular system, as we say, is not as dynamic as compared to the 3.5 kilo baby. So when the body size increases in adulthood, the cardiovascular system will not be able to meet the demands of that weight. So that can cause hypertensions or any other cardiovascular disorders. So similar thing applies for all other systems. So this is the way it can impact the adult or a long-term life. If the growth is compromised in the earlier period, the resources are limited, the organs grown are limited, they cannot be able to supply the demands in the adulthood. Okay. Yeah.
So then, as you spoke that development is more about quality, so how do we understand child development?
Development is it's a quality. That means how much capable the baby can perform the function. It is increase in the functional capabilities of the baby. When we see development, there is something called developmental quotient. Developmental quotient, like how intelligent quotient, it tells how is the development of a kid. So it has certain domains in it. Development, when we talk about the domains, there are social development, the child has to get socialized. There is motor development, the child has to develop motor capabilities like mobility to reach, to handle the normal life. And there is a language capabilities, which is a speech development, and there is a cognitive development, intelligence. So there are 4 domains in it. So when we come to the motor development, that is the development in the physical capacity of the body. There are golden rules, like it is always head to toe. When the baby is born, the head control comes first, then comes the lower muscles, that is the shoulder control, then arms control, then the abdomen and all. So the neck control is achieved around 6 to 8 weeks of life, followed by the rolling over. Rolling over we see from supine to prone we see around 4 to 4.5 months. From prone to supine we see around 5.5 months. A baby can sit independently around 6 months, and a baby can stand independently around 1 year and walk later. This is how the motor does. It is going from head to toe. Neck control, rollover, sitting and standing, then walking. This is about the gross motor development. When we come for the fine motor development, that are the fine skills. If you have observed the baby, when you give something, when the newborn baby, it holds with all the fingers. It is called palmar grasp. This is a crude way of holding. But when we see the 9 months old, 10 months old baby, when we give something, it holds with 2 fingers. This is pincer grasp. It's a improvement in the motor functions. This is a fine motor improvement. So this is how the fine motor developments take place. And according to this, we can stage the baby as a developmental age. For example, a 1-year baby still has not learned to sit. The developmental age of the baby is less than 6 months, whereas the chronological age is 1 year. Yeah. And regarding the cognitive development, it's about intelligence. I would say what are the things which limit the intelligent developments are most commonly the screen time. Because they are naturally explorative, all we have to do is let them explore the world. We are not doing that because we are using sometimes shortcuts to keep them quiet, to keep them obey our commands. We do that. So we give screens. That is limiting them to understand what is going on around the world, and that is the root cause of autism. They don't want to talk. Autistic child don't want to talk, don't want to interact, don't want to play. So treating autism again is a price which we are paying by showing the screen. So I want the parents to understand, involve them in the music rather than screen times. You can involve them in the music. Music is also equally entertaining. If the child is not aware, there is something which is called screen existing in the world. So you can play them different kinds of music. Music itself is a language, because child is learning to learn things. Even language is a sound. So music is also a kind of language. They can understand, they can enjoy it more. So for soothing purpose, you can always use the music, to console them rather than using the screen time. About the socialization, the psychosocial development, nowadays educated parents both are working and the caregiver is giving the baby care, the maid is giving the baby care. So there are only two persons in the home. The baby is not at all getting socialized. That leads unusual anxiety in the baby when he meets the stranger. He doesn't want to involve with them, or maybe scared. He will have his own comfort zone around the known people. Early socialization, mingling with the community, will help the child to break these boundaries and explore more. So ensure that you call other families, or you go to the other families and other childs and make the child play with everyone, so that early socialization makes them grow better in the social milestones. Regarding the cognitive milestones, the intelligence, we have talked about the language. Language is another important domain which we have to emphasize, because language is something learnt by talking, by listening. So if there are only two parents and not having many people at home, the language stimulation is less. The more the baby hears, the more the baby comprehends, the more the baby speaks out, and the faster the baby does the job. So language delays are commonly seen in working parents. Most of the parents come, sir, my baby can walk, my baby can do all the motor activities, my baby can do intelligent activities, but he does not speak as much as the same age group of other child. Then I will ask one question, how many people are there in the home? They tell me, husband and baby. So where is the stimulation? So it is important, speak as much as possible, involve as many people as possible, stimulate as much as possible. Language development delay is a kind of, given one. It is not the inherited one. Of course, other things can influence the language delay, like hearing defect, brain insults. These all can influence the language delay, but they are not very common. Yeah.
So doctor, we spoke about most of the aspects. Also about the skin problems. What could be the skin problems faced during infancy?
There are many skin problems which we see. Some of them are normal, some of them are not normal. As we discussed, erythema toxicum is the one thing, normal newborn skin rash, which comes soon after the birth because of the contact with the first time contact with the many of the components outside, like dress, air, touch of the parents and all. So that is need not to be worried. It will subside by itself, need not to be treated. And other problems, there are some birthmarks. We see hyperpigmented lesions on the body. Some of them are green color. We call them as mongoloid spots. They are self-limiting ones. It diminishes and it disappears by itself. And there are some called Port-Weinstein's hemangiomas, where the skin is not developed properly. It need not to be worried if it is in the range of the norms. There are specific norms for the size of the hemangiomas, and if this is not in a usual site like body or leg, it's fine. But if it is in the head and neck region, we have to do the cranial scan to see if there are hemangioma inside the intracranium. So that is about hemangioma. And when we come for the infections in the skin, there are many possibilities like candidal diaper rash. We already mentioned in this. There are infections like staphylococcal scale skin syndrome, bullous impetigo, and abscesses, blisters, which commonly form by coming in contact. That is about the infections. As when we come about allergies. Allergies is one of the dominant skin problems in the infancy, because new food has been introduced, new contacts are happening. So among the allergy things, the eczema is one of the leading cause in Bahrain. We see a lot of skin problems of eczema here. Eczema has its two phases, acute phase and chronic phase, and it has variables. It's a kind of dermatitis. Dermatitis is inflammation of the skin. So we see in acute phase as a simple rashes, maculopapular lashes or eruptions. As it goes to the chronic phase, it becomes thick and lichenified. These rashes are characterized by maculopapular rashes with kind of symmetry on both the sides, with lot of scratch marks, and with uniform geometric lesions are seen. It can be seen anywhere in the body, but how to take care of it? How to take care of it we can address once we come after the subcategorization. So what are the subcategories? There is atopic dermatitis. Atopic dermatitis, exact etiology is unknown, but it has a similar pattern like acute and chronic phase. It can, most of the hypotheses are like it could be inherited, genetic factors, mother had or grandmother had, father, grandfather had, that can contribute for the probability of it. And second thing is allergens, irritants, like using linen cloths, woolen cloths, dusts, mite, and these things can stimulate for this kind of reaction in the skin. And another thing is called seborrheic dermatitis. Seborrheic dermatitis is seen as a dandruff in the scalp, a scaly lesion in the scalp that is very itchy, and child will become irritable, and there is unexplained cry in a child, not able to feed and all. The causative agent is a fungus here, it's a Malassezia furfur. We are in a humid atmosphere, a sea zone, so this also we see commonly in Bahrain. Then yeah, these are the common things. How to treat it? Maintaining the hydration is a key role. If the skin is dry, there is all possibilities things can go wrong. You have to keep the moisturizer always on the baby, and you have to take care of the hydration. And you can also use emollients, petrolatum jellies you can use regularly. And when these things are so severe or itchy, we can use antihistamines to cut down the irritation of the skin. And we can also use an advanced treatment like ultraviolet therapy, UVA and UVB therapy we do, and we can use steroids. But one caution I want to tell to parents is, don't use steroids on the head and neck region, because steroids will bring down the symptoms. Parallelly, they will also cause hyperpigmentation. There will be permanent mark on your skin, which will cause cosmetic interference with the child's appearance. So that is the one thing I would, and better to use mild steroids than the strong steroids. And we can also use steroid substitute drugs like tacrolimus, kind of drugs which are available and which are showing promising results. Yeah.
So doctor, there was a lot of information provided in this episode. So what would you like to tell the parents watching this episode? What is one takeaway message that they must take?
Throughout my experience, I have seen educated parents, I have seen best parents, but not all parents are aware of the things which go through the journey of a child. Because when we were child, someone took care of us, and we forgot it. Again, it's a new journey for us. So being proactive is one of the very important thing all parents should consider. You can always tell, I don't know. There's nobody going to judge you, because it's a new journey. You can always ask for help. You can ask, sir, where all the things can go wrong, or what are all the precautions I have to take care, and how I have to be prepared. Most of the parents are focused on the current problem. That means today baby is crying. See, baby is changing every day. Today's problem will not be there tomorrow. The crying baby may not be crying baby tomorrow. What we see as a subtle symptoms may not be there tomorrow. Always be prepared for the next stage. When the baby neonate become infants, what are the things have to be ready? When the infant becomes a toddler, when they go to the school, what are the things have to be ready? I can expect, or which are the things I don't know. Being proactive makes the child life much better, go through the transitions much better, and that's all you can be as a best parents. And make sure you attain the normal growth rate in a child. I tell always parents, like, if the optimum growth is not reached, for example, if the baby is not 10 to 12 kg by 1 year, it's a gross mistake from the parent. It's not a child mistake, gross mistake. So correct it as early as possible, educate yourself as early as possible, take integrated health packages. In Al Hilal, we have a lot of integrated health packages. We are giving complimentary free consultations for every vaccination visit, and we are also giving the nutritional counseling and parental education as a complimentary package, which will help them to attain bigger goals very easily without stress. They can be confident all the time. Yeah.
Thank you very much, doctor, for that very valuable session with us. Thank you for spending your time with us. I hope this episode was quite helpful for parents out there. We will be back next week, same day, same time, with yet another informative episode. This is Marina signing off. Stay healthy and happy. Good night.
16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.